to Connection Complete. I'm your host, Julia Barker, and I'm here with my co-host,
Mary Beth Patricus, Mama Bear Productions.
Beth Notarius Inc.
We are happy to be at the Brighton Chamber of Commerce at 218 East Grand River here in Brighton, downtown. And today we are so honored to have Dr. Ellen Koch from McCaskill Family Services with us. Today we're going to be talking about PTSD and a little bit of, we want to talk about the stigma and really defining it, talking about signs and symptoms and helping to educate you, our viewers, on a very important health topic. Livingston County has a very large population of veterans, and we really do come across this, I'm sure, a lot in Livingston County with vets. But I do want to talk about how it affects those who are not related to combat services and discuss that a little bit. So if we could just open it up with you, Dr. Koch, to help our audiences understand what PTSD encompasses.
Sure. So PTSD involves being exposed to some extreme stressor, and that could be anything from combat to sexual assault to a car accident to a natural disaster like a flood. So some sort of extreme stressor, and then the person develops difficulties as a result of that. So they often may avoid wanting to talk about it or to think about it if they can. They experience increased arousal, and so they might be more jumpy or startle more easily. And they also experience these sort of intrusive symptoms like thoughts that pop into their head, or they may experience nightmares. So there's a variety of symptoms that can develop from PTSD. And when you have a severity of those symptoms and a frequency of those symptoms, then you can meet diagnostic criteria for PTSD.
Go ahead with our questions here, Mary Beth.
Well, what are some of the signs and symptoms of PTSD?
Yeah, so again, if you are experiencing some of those things, like you're trying to avoid thinking about something that happened to you that was particularly traumatic, or if you are startling easy, sometimes people with PTSD have a lot of concerns about safety. So for instance, you might know someone who needs to be in a restaurant with their back facing against the wall and where they can see the door, so they can see what's coming. They never want somebody to come in behind them. So that would be typical of somebody with PTSD. They might be uncomfortable in any situation where they can't scan the whole environment and really know what's going on. Somebody who's experiencing nightmares is a really classic symptom of PTSD. So those are the kinds of things that you would look for.
Are there, from a community standpoint, one of the things that I understand as a grief recovery specialist is that how our fellow companions in life don't actually support. We're trying to help so much. We're trying to help each other, but not knowing how.
Yes.
And I'm wondering, is there stigma that prevents people from being able to support each other better?
Absolutely, I think there's stigma. I think there's a lot of stigma, particularly around mental health. I mean, as a society, we tend to think negatively of folks that are struggling with mental health issues in a way that we don't when somebody has a medical concern. So I think it is difficult to understand that that person's experience is their individual experience, and two people can experience the exact same event, and one might develop PTSD and the other one might not. So I think we have to be really careful not to be judgmental of people and assume, like, what's the big deal? Get over it. I did. It wasn't that big of a deal for me. So I think to try to really understand somebody and talk to them and understand where they're coming from and where they're at in the situation can be really valuable to counteract some of that stigma, because it is very common in society for people to say, like, just get over it. What's the big deal? Like, stop thinking about it. That's what I did. And it's not that easy for some people, particularly if anybody's been diagnosed with PTSD.
So it's really honoring that everybody is unique and
Correct.
individual, and there's other things besides just one event that is playing into those fears and feeding that trauma.
Absolutely. It's a lot of people's history, maybe their previous trauma experiences, maybe their experiences in that moment and their mood might be related. I mean, there's lots of factors. Whether or not somebody was drinking at the time of the trauma impacts whether you develop PTSD. There's many, many risk factors for PTSD, and many things have been related to the development of PTSD medically. But for each person, it's sort of an individual constellation, at that time of the event that can really set them up to develop PTSD or not.
Wow.
Yeah. And so we might not even know all those risk factors for an individual. The person's probably not even aware of all those either in the moment. But certainly people can have very different responses. I did work with acute stress disorder, which is a trauma and your psychological responses within the first 30 days of that trauma. So it's sort of like pre-PTSD, because PTSD takes some time to develop. And so folks with acute stress disorder, I might have somebody who had a minor car accident that was really struggling, and somebody else had a pretty massive car accident and was doing fine. So it really is, there's a lot of individual difference, and I think where it can be harmful for folks that are struggling is when people just assume, like, what's the big deal? Why are you having so much trouble with this? And so if we can just be a little more understanding and sensitive that there's lots of factors that probably contributed to why they're where they're at, and just listen to them as much as they're willing to share. Certainly people that experience PTSD, there's lots of things they're probably not willing to share. There can be a lot of shame around the trauma that can really be difficult for people to deal with, but also just wanting to avoid it and wanting to push it away. Even though that doesn't work, they try to do that because it can be so difficult to deal with these memories head on.
Oh, no. Go
And you
ahead.
were mentioning too that it can be gender related, so depending on the source of the PTSD, right?
Yes.
Men versus women.
Correct.
So do you want to address that a little bit?
Yeah, so men are more likely to experience traumatic events at a higher rate than women. So they're more likely to have physical assaults and things like that as their sort of more common experience. But men are much less likely to develop PTSD, where women might have fewer events that they experience in their life, but they have a higher probability of developing PTSD from those events. So there are some differences in terms of gender. And whether or not stigma has a role in that, I think is a little unclear. But potentially that plays a role. I think it is harder for men to seek help and be willing to seek help than it is for women.
And that kind of flows into another question. Julia had a really good question about, children
Yes.
and trauma and
Yes.
maybe PTSD too. So can you kind of give us some information on that?
Yeah, so children are more likely to do sort of overt external behaviors and sort of acting out. And so you might experience an increase in sort of problem behaviors in a child, where you might not have that as much in an adult. Adult might be more likely to withdraw and not share and talk about it, where a child will be more likely to trying to get help in a way that involves creating some behavior problems probably for parents or the school system or whatever. So you're more likely to see overt behavior from a child.
Okay. Okay, and then quietness and revert.
Typically, yeah, and again, not everybody responds that way, but typically most people are trying to avoid and they don't like to talk about it. And again, particularly if there's shame around it, as an adult, they're probably going to be much less likely to talk about it.
Can we talk about the reactions that maybe you wouldn't be so quick to associate with PTSD? You talk about withdrawal, maybe that makes a lot of sense, but I know I looked up some symptoms such as bedwetting, symptoms like that where you might not immediately correlate it with PTSD. Can you talk about symptoms?
Yeah, so I know less about kids because I work with adults actually.
Okay.
But certainly it would make sense that you would see problems, again, bedwetting would be common. Maybe kids that might sort of revert developmentally to a previous stage would not be uncommon if they've experienced a trauma. You wouldn't see that as much in adults.
Okay. And with adults, are there any symptoms that are kind of, as a professional, you have that light bulb moment, this is what you're going through, that maybe the average person wouldn't correlate with PTSD?
Other than asking specifically about the symptoms of PTSD, which can give you a lot of information, there's also a lot of comorbid conditions that can happen with PTSD. So other anxiety disorders, depression can be really common with PTSD. Some people may have a panic attack at the time of trauma, so they may have panic disorder and PTSD at the same time. So as a psychologist, we look for those comorbid conditions, as well as do they meet the standard criteria for PTSD as well. Because comorbidity, unfortunately, is more the norm than the exception. So you would rarely have somebody that would only have PTSD. They're usually struggling with some other conditions as well.
Okay. We're going to take a short break and have a word from our sponsors. When we come back, we're going to continue our talk about PTSD with Dr. Ellen Koch. We're back with Dr. Ellen Koch of McCaskill Family Services. Thanks for coming out today.
You're welcome.
We really appreciate your expertise on PTSD. I wanted to lead into this question. We were talking about how PTSD is, also sometimes ongoing with, say, an anxiety disorder, perhaps phobia. And we saw this awesome clip, thanks to Beth sharing it with Mary Beth and I, of you on Good Morning America, awesome, helping to treat patients with phobias using a 3-hour treatment. And in this GMA clip that you can find on your website, this woman was conquering her fear of heights.
Yes.
And can you kind of talk about a common denominator between patients with PTSD and phobias and how those two are related?
Absolutely. One of the big ways they're related is just in terms of the way that we do treatment. So in that one-session exposure procedure, the individual is confronting their fears one step at a time and waiting till the anxiety comes down. We use the same principles in relation to PTSD too. It is not easy, as it wasn't easy for Jane in that Good Morning America clip, but with folks with PTSD, we're reviewing the memories of what happened and the story, and through the process of telling that story, the anxiety gets reduced, and also individuals can really start to sometimes organize their memories, and sometimes maybe even new information comes back. Sometimes there's gaps in memories as a result of PTSD. So it's still the same process of confronting that anxiety. This time it's more memory-based as opposed to climbing into a trapeze, but it's still the same process because what happens when people try to avoid those memories, they actually just become stronger and more intense and more difficult. And so we face those memories head on until they no longer have that same physiological reaction that come with them in the exact same way that we would treat a phobia.
Amazing.
Yeah.
It is.
Well, and there's, for those who can't necessarily can pay for services at McCaskill Family Services, you and Dr. Bird and some students too at Eastern Michigan University have this really nice clinic.
Yes, yeah, we do. So I am also a faculty member, a professor at Eastern Michigan University, and we have a psychology clinic with our university where our doctoral students in clinical psychology see individuals. And we have a very reasonable fee. These are students that are learning, but they are well supervised by faculty members at Eastern. And the session fee is $10, which is much more reasonable for individuals that can't pay. We do have quite a waiting list, unfortunately, as you can imagine. There's a lot of need for psychological services for individuals that particularly don't have insurance or don't have an ability to pay. But this is another resource for folks, and they can find out how to contact us through the EMU Psychology Clinic website. There's a phone number there.
Now, you had mentioned earlier too that during the summertime there seems to be a lull with that, so, and I don't recall why that was.
Yeah, so our students pick up cases based on their schedule at different times, and the students that are first starting to see clients start in May, and so they're picking up a lot of cases in that time period, and then a few others as times go on, and then in their second year of seeing clients, they're also at external practicum sites, so they're all over Wayne County, Washtenaw County, seeing clients as well, so they only see maybe 1 or 2 clients in the clinic at that time, so they're, with the fluctuation of caseloads over the course of time because of our program, that makes a difference in sort of how quickly somebody can get in to see a therapist.
Okay.
Yeah.
Very great, thank you.
And just getting toward the wrap of our episode here, if you can give our viewers information how to contact you, your website over at McCaskill Family Services, please. That way, they can have a resource. Like you said, unfortunately, the EMU clinic, it has a long waiting list, but I know that what you're doing over at McCaskill, it's awesome work, and if you could just share that information, how to contact you there.
Absolutely. So our website is McCaskillFamilyServices.com, and the phone number is 810-224-1676. So we have immediate openings in both the Brighton office that we have at the Grand River Annex, as well as our Plymouth office location.
Oh, cool.
Yeah.
2 locations.
Yeah.
And then just lastly, we did mention a resource where viewers can get more information about PTSD.
Yes.
If you could give the website for the PTSD, what was it?
Yeah, the National Center for PTSD. So the National Center for PTSD is ran by the VA system, and they provide a really nice set of information for caregivers or family members or loved ones who may be impacted as well by an individual with PTSD. And that website is ptsd.va.gov. And that's a great resource if anybody wants to learn more about PTSD and how we treat it.
And you don't have to be a veteran
You don't have to be a veteran, no.
to check out that site and the
Absolutely.
resources that are there.
Yep, and that information is good about PTSD, whether it's related to combat experiences or military sexual trauma or any other kind of trauma. It's a great resource for everyone.
And we did say that there's even a little a quiz, something that you can kind of look at to see if maybe this is something affecting you or
Yes.
someone you love.
Absolutely. So they have a lot of information about the signs and symptoms of PTSD and what you can expect. And you can sort of, if you're kind of wondering if you might have PTSD, that website would be a great place to sort of start to explore and see if that's relevant for you.
Fantastic. Thank you so much again, Dr. Koch. It's been awesome having you today.
Well, thank you. It's been great being here. I appreciate being asked.
I feel like the connection's been completed.
That's right.
Thank you.
Alright, this has been Connection Complete. I'm your host, Julia Barker. With me, my co-host.
Mary Beth Patricus, Mama Bear Productions.
Beth Notarius, Inc.
We're looking forward to our next episode where we'll be discussing a little bit more about the opioid epidemic with Dr. Francine Zisk of Project Opiate. Thanks so much for watching.